Become a miracle maker now.
I believe in miracles.
Call 866-970-GIVE.
I'll give up my candy bar to help kids.
The Missouri Credit Union Miracles for Kids Radiothon on Y107.
We are here joined by Dr. Severance, hematologist, oncologist. Thank you so much for joining us and for everything that you do. We had a great conversation. And also, I love your tie. Sick bow tie. That was actually what I wanted to open with. I love your bow tie. Can you tell us just a little bit about what you do at the hospital and the impact that it's had on you and as well as just the patients? That's a very loaded question. But
absolutely. And thank you so much for having me here today. It's an honor to be with y'all, and it's really incredible to see the infrastructure and everything that you guys are doing to help our patients. Once again, my name is Tyler Severance. I'm a pediatric hematologist oncologist, which essentially means I'm a blood and cancer doctor for children. And I have probably the greatest job on the planet. Day in, day out, I get to work with children with blood and cancer disorders at all stages of their journey. And that's not just the tough conversations on day one, but it's helping children navigate chemotherapy, treatments, and then ultimately transition into survivorship. We've got some incredible teammates that we get to work with. We've got some of the best nurses in the state. We've got some really awesome colleagues in our division. And I'm really excited to be here, both representing the university, but also getting to chat with you all. Thank you so much.
I mean, speaking of, you talked about a bunch of different people that you work with. You were talking about, like, you collaborate with a lot of different aspects of the hospital, and you had a really cool story. Do you want to share that?
I would love to. One of the most impactful patients that we've had in recent years was the story of a child with a very challenging type of lymphoma. And ultimately, this was a patient that required many months of continuous hospitalization and, most importantly, required a lot of collaboration. This included kidney doctors, infectious disease doctors, surgeons. We had every member of pharmacy. We had our child life forces in tow. And over the course of many, many months, we gradually were able to get the cancer under control and ultimately clear the hurdle and transition to survivorship mode.
And you rang that bell, right?
Yes, I'm so glad you brought that up. To those that don't know, ringing the bell at the end of one's cancer treatment is probably the coolest, most exciting moment in all of healthcare. Here you have a child that has navigated the entire spectrum of treatment. So they've had the really tough conversation. They have overcome side effect after side effect. And then there at the very end, when they are disease-free, they're finally done, they get to ring that bell exactly like you're hearing now.
That was perfect timing.
And it truly is. And it celebrates a culmination of their entire journey. But they don't ring that bell by themselves. And their whole family, their community comes to join them. And the healthcare team that was part of it is also there. And what was particularly impressive about this patient is the sheer number of people that were involved, that were all there in that moment. Everyone from the pharmacist that made the chemotherapy, all of my partners, all of the nurses, both in the clinic and in the hospital, the child life team, even the residents that were on vacation came in from across the state. And we all got to ring that bell together alongside him. And it's just one of the most uplifting, incredible things you'll ever experience.
And you talked about it's not just, after that bell. There's a process afterwards, and you continue to take care of the patients after ringing the bell.
Absolutely. So what we'll say is survivorship starts at diagnosis, and it continues well beyond the end of chemotherapy. These are patients that now need to get back in the swing of things with school. They need to adjust to the trauma of their cancer experience. They need to get used to navigating, what's it like when I get a sickness? Is it the same as stay home from school, or do I need to be seen by a doctor and have a whole bunch of blood tests again? And it's really a challenge, and it's, again, one that we don't have to face alone. And that's why I'm so grateful for the child life team, the art therapy team, the school team. We have an academic liaison to help make sure children don't miss a beat when it comes to their schooling. And again, I should say a lot of that's all possible thanks to you guys. So to those that are supporting the Children's Miracle Network, thank you, thank you, thank you.
One more question before we let you go here. You said something off air that I was like, no, we need to talk about this on air. We have this new hospital being built, and it's amazing, and it's highly technological, and it's going to be a really good thing. But What is it about this that what we're fundraising for?
So I'm smiling here. I was thinking on the way over, what would the new children's hospital be like if it weren't for the Children's Miracle Network? And the best example I could come up with is that it would be like the Death Star. So you would have this big, impressive building, and yes, it would have the monitors and the equipment that we would need to care for children with illnesses, but it wouldn't have that life, that joy, that rich community feeling. And so the difference between CMN and without is that when you walk into the new children's hospital, it really feels like a children's hospital. That uplifting sense that, hey, we got this, you're not alone, we're in this together, whether it's the Child Life team, the amazing nursing staff that we have, it's all of that coming together to make it a welcoming environment, and it's really just breathing life and community into an otherwise, impressive hospital. So it really is awesome, and nothing against the Death Star, obviously.
No, I mean, I think that's absolutely amazing. If you want to breathe life into something, make sure that it's not just a Death Star. You need to make sure that you're supporting these programs that CMN is supporting, and you do that by becoming a Miracle Maker. 866-970-GIVE. Thank you so much for stopping by today.
I really appreciate you guys. Thank you so much for having me.
Thank you. It is the 18th Annual Missouri Credit Union Miracles for Kids Radiothon on Y107.